Meniscus injuries can affect the knee in two ways. You can get a traumatic one where you twist and damage the meniscus, the cartilage in the knee here, or you can get a degenerative one where it wears over time. But if you're not sure if you might have a meniscus injury, and in the absence of an MRI, which is kind of the gold standard for diagnosing it, you could check these three things to see if you might have them, and it might indicate that you have a small meniscus injury, either a tear or degenerative change on the top. The two things that you need to look out for are, firstly, the location of pain. Are you getting pain here, right where the knee kind of bends on either side here? That would be an example of pain. It might be tender to touch as well. Also, are you getting noisy clicking, popping of the knee when you straighten and bend? So, for example, if you hold the knee like this, as you bend the knee through range, is it clicking or popping? And the final probably key indicator for a light meniscus tear or degenerative change is when can you not take your knee into full extension or full flexion because the pain hurts. So in the presence of those three things, you might want to surmise that you have a small meniscus tear, meniscus injury, and these respond really well to physiotherapy. In fact, some studies have shown that meniscus tears of this nature tend to perform better than surgical intervention. So that's in our favour and good news. The first thing we need to do with these kind of tears, whether degenerative or traumatic, is to restore the range of motion. And that's what I get my patients to do immediately. So, the fact that you can't bend fully or straighten fully, that needs to be addressed straight away, because we don't want to strengthen the quads too much in that position. We want to kind of restore range first and then start introducing some more robust strengthening work. So I would ask you guys, if this is you, to gently try and work into flexion and extension. And that just means maybe taking the knee, you can either do this in sitting or lying, and just pulling it in. So you're kind of working into the discomfort a little bit here. So this is to try and restore flexion. You can also do this with your foot on a chair, like so, and just gently try and push through. So your weight's on the back foot here, but you're just trying to get some pressure through the front of the knee here to increase the flexion. And we also want to try and improve the extension. So the extension is where we do this movement here. And so you can do this in standing as well, where you're just trying to encourage it down into full extension. So you need to work into discomfort a little bit with this, but this is the first thing that you guys need to address, is to try and restore that range of motion. So, and then from there we can sort of build in some more robust exercises. And I've got a video on my channel about how I resolve my meniscus tear that you might want to have a look at. So in the meantime, let me know how you get on with this. I'd be really interested to hear your views and how you've got on with it. And also in the meantime, if you want more information on staying fitter, stronger and healthier and reducing your pain, please drop me a follow.